Now, moving on. I said in the beginning, dedoc Doc Days started in Sweden, in Stockholm in 2015 with EASD, and we're now going to Sweden to welcome Sara Mobäck. How are you?
Hi, I'm totally fine here in Sweden, in Stockholm, and I wanted to start with I'm so incredibly grateful to be invited to this amazing event and this day today. And my name is Sara, and I have the Sweden's biggest blogs about type 1 diabetes, where my focus is mainly on the mental health and diabetes and diabetes and eating disorders, when I myself was affected a few years ago. So type 1 diabetes are at a heightened risk for mental health issues, including depressions, anxiety, diabetes, distress, and burnout, as well as eating disorders. And this is the topic I will be speaking about for today, like diabetes and mental health. It is scary when you read all about this, and that it is so important that we do something about it. It is, of course, important that research is ongoing for the development of technical aids, but that's not like the only thing. For all healthcare to be effective, it must include mental health and well-being. It doesn't matter if you have all the technical devices in the world, if you still cannot manage your mental health, right? Even if a diabetic has a good A1C, how does the healthcare people know if the person is well if you don't ask for it? This is where it lacks, in my opinion. It should be as obvious a part to ask as it is to measure the A1C, for example. The patient meets the healthcare people during a very, very small part of the life. Therefore, you must manage your diabetes yourself. And then it's so important that the healthcare people don't just look at the curves, values, A1C, your feet, and the eyes, for example. Mental health must be included. It has to be a good balance between the mental health and the diabetes. And for the last part, we can't forget about the quality of life, because even with a chronic disease like diabetes, we can still make a really good and valuable life. We must make sure that the soul is in a good condition, addition to all curves and values. Thank you.
Thank you, Sara. Very important point, and good to see you back here at Doc Day. Thank you for presenting. I couldn't agree more about the importance of mental health, especially when it affects mostly young women then with diabetes and eating disorders, or any other kind of cross, I don't even want to call it complications, but when one chronic disease mixes with another one, I know what I'm talking about. I have several chronic diseases as well. It gets even harder no matter what it is, and it does affect mental well-being, etc. So thank you for raising awareness through this, through your blog and your Instagram. You are a true influencer in that sense of the world in Sweden, in that sense of the word, sorry, in Sweden.
Thank you.
Thank you for doing all you do.